So one of the most common questions that I get asked is how can chiropractic help improve pain, symptoms, and improve my overall health? Great question. We're going to answer that question today. Hi there, Dr. Sandhu from Bedford Chiropractic Clinic. To all my Bedfordshire community, I'm here to help you. For everyone else watching outside the Bedfordshire community, this is really useful information. I encourage you to watch to the end because I'm going to give you some tips that are going to be life-changing if you do them. So here we go. So how does chiropractic work? Well, let me go right from the basics. So chiropractic is all about basically looking after this incredible, very important structure that each one of you has. Hopefully. Absolutely. So you have the brain sitting here, sort of in this skull, and the brain then comes into your body. And this is the way that it gets into your body. It comes into your body through these 34 vertebrae, 7 in your neck, 12 in your thoracics, which of course include the ribs, and 5 in your lumbar spine. Then you've got this sacrum and the coccyx at the bottom, and obviously joining to that is the pelvic girdle, which is your iliums, your SI joints, and of course your pubic symphysis. But this is where the brain comes out. So if I just use this illustration here, you can see here how the brain sits there, and then all these yellow lines represent the brain going out. And you're looking at about 120 miles of nerves going out and providing 32 trillion cells in your body, helping each cell, muscle and joint, organ to work efficiently and effectively for you, allowing you to do all the most incredible things that we as human beings are lucky to be able to do. The way that I make it sort of easier for you to understand, hopefully, is that this is the generator. You have the brain, which is like a power generator. And then you have this 34 are the fuse boxes. We all know what a fuse box does. A fuse box sort of allows a point of electricity to come through and to go through safely to wherever we want it to go. TV, Hoover, whatever, electric socket. So these are the fuse boxes, and these fuse boxes allow these nerves, so these electrical wires, to go out. For example, my fingertips here have an electrical wire, nerve that comes out of my neck, runs all the way down my arm, and goes all the way to my fingertips. So I am able to move that fingertip by thinking about it, creating an electric current that will run out and will send a message down to that fingertip muscles and will allow me to move that fingertip muscle. Contract or relax it, contract or relax it. That then has an effect on the skeletal structure, your skeleton, and the muscles then move those skeleton bones, and we're allowed to move our fingers, hands, wrist, elbow, and so on and so on. So that is how, very simply, basically, the human body works. How does chiropractic help that? Okay, so if you have a joint that is stuck, that is not moving properly, then can you see how that could potentially interfere with the nerve signal? For example, if I have a hose pipe, right, and I put my foot onto the hose pipe, then invariably what's going to happen is that the water coming out of the end of the hose pipe is not going to be as strong a flow as if I didn't have my foot on the hose pipe. Does that make sense? So if I take my foot off the hose pipe, the water flow is going to increase. So here I have a nerve. If I have something that is interfering with that nerve's output, so the electric signal, and is causing that nerve to not fire at full strength, can you see how that would have an effect on the end point, which could be a cell, tissue, organ, muscle. So if that muscle, tissue, organ doesn't get the full message, then that is not going to work as well as it could do. A very sad and classic example of this is when a person has an injury to the spine. So for example, an example that some of you may remember was Superman, Christopher Reeve. Christopher Reeve, 6'4" guy, very well muscled and all of that, incredibly powerful looking gentleman. And he basically fell and damaged his spine where he broke his sort of, I think C3-4, broke it there. So none of those nerves firing down from below weren't functioning anymore. So the fuse box had basically blown. It had been cut here. So when that happened, none of his organs, none of his muscles were working below that level there. And he had to have 7 machines, regrettably, sort of for the rest of his short life, keeping everything working, providing the function of what those organs could do. And he was stuck in a wheelchair. And that is a very extreme example of where the nerve doesn't fire to that muscle or joint. So how can chiropractic help? Well, when you basically just make sure I'm covering everything, yeah? So when we have a muscle tension, we have sort of a chronic problem where what we're doing is we are constantly, say, sitting for 7-8 hours a day. What we're going to do is we're going to put a lot of pressure on these bones here and of course the other ones above, but in particular these 5. And that pressure can cause what we in chiropractic terms call a joint dysfunction, misalignment. For another simple explanation, a joint getting stuck. So where the joint is not flowing and moving as well as it could do to its full range of movement. When a joint doesn't move to its full range of movement, what happens? What happens is that you're creating an inflammation. You're creating a aggravation to those muscles where the muscles around that joint are going to tighten up. They're going to try and lock it up because the body doesn't like pain, and it knows that if it moves, you're going to feel pain. So the body's going to do everything it can to lock everything up so that you can't move as much, so you're not going to create as much pain. So that is what is going to happen, right? So if that is the case, then we need to get that joint moving back again. Would you not agree? So we as chiropractors are trained to check you through motion palpation, actually moving you and feeling sort of the joint movement. And we are, over the years, have enhanced our ability to be able to sense where a joint or a muscle is tight and is stiff. So by finding where that is, we know then that, for example, that this joint here, right, is a bit stuck, is not moving as well as it could do. So we need to get that joint to work. Now you might be feeling a symptom of back pain, you might be feeling a symptom of pain around this area, you might be getting sciatica, because sciatica is basically the nerve here. It's these 3 nerves running down the leg. So if you have a problem right here, that could cause pain to be felt all the way down that sciatic nerves, down into your foot. So the sciatica is coming not from here where you're feeling the pain necessarily, it might be coming from a problem here in your spine, right here where these nerves come out, or through the SI joint, or through the muscles that actually it goes through as it comes out of your buttock here, through the piriformis muscle or the glute muscles. So as a chiropractor, we're trained to find out what is actually going on there. So it's really, really important that we find the cause of the problem. So what we do then is we as chiropractors will basically go in and we'll get that joint to start moving again. And that is where a chiropractic adjustment will come in. And you may have seen some videos where people have been put onto a bench and the chiropractor looks like he's jumping on them and creating sort of movement in there to try and sort of get that joint to move. And what he's doing, he or she are doing, is they're getting the joint to move again. So get it back into its full range of movement. Because when you get this full range of movement, it's like taking the foot off the hose pipe. Because remember that example I used earlier about the foot on the hose pipe stopping the water flow? Well, by taking the pressure, the inflammation off the nerve, we're allowing the nerve to fire at 100%, 90%, and we're getting it then to get the message back to the muscle or organ or joint, so it's working better for you. So that is what chiropractic is all about. So chiropractic is basically about finding where there is a joint that is stuck, that is not moving well, and getting that joint to function back to normal range of movement. By getting it to move back to normal range of movement, we are going to allow the nerve to fire at its full power, which is going to then allow the muscle, joint, organ, wherever that nerve is going to work properly again. And by doing that, we're going to reduce your pain because the muscle has now come out of spasm, and also the joint has gained its full range of movement, so you've got your full movement back. And because we've got the full movement back, we've reduced the muscle spasm. The chemicals that your body is producing, the inflammatory chemicals, reduce down, and your pain level goes down as the inflammation goes down. Because inflammation is why you feel pain. And what we're trying to do is we're trying to reduce and control that inflammation with the chiropractic adjustments. Now, let's make sure I've got everything there. Now, there's all types of pain, as I'm sure you're all aware. There's chronic pain, which you've lived with for years and years and years, and that chronic pain has created then damage. And this is why it is so important to make sure that you are sort of basically using props. You can't work with props, you can't work with children, you can't work with animals. So what we have here is we have sort of a deterioration where you have sort of that, and that can then potentially become that, and that can then potentially become that. So those are the stages of wear and tear. Osteoarthritis is another name for it, right? And that is something that can be avoided, because if we get to this stage where it's a bit stuck and we get that movement back, we won't allow it to get to that stage. And if we get to this stage and we get this one moving to some degree, we will stop it from getting to that stage, because arthritis, left to its own free will, or it's to what it will do, it will carry on. It's progressive, but it can be stopped. And that's what chiropractic is all about, is getting your body working as well as it can for you, so that you can then sort of get rid of your symptoms. Obviously that's chronic pain. There's acute pain where you've just had an accident. Just this morning I had a gentleman who'd sprained his ankle over the weekend, came in, and we managed to get the ankle back to full range of movement so that the inflammation went down, and he's going to heal a lot quicker than if he just waited and left it to see that if it would heal by itself. So we can treat all kinds of conditions. Now, one of the great things about chiropractic is, yes, we treat this, but the most important thing that we do as chiropractors, and certainly I do, is we look for the reason why. We look for the reason why have you got those symptoms in the first place. And it could be due to your posture, could be the way that you're standing, because that affects your neck and also affects your low back. It could be coming from your foot, because if you're supinating, pronating, this is pronation, which is more common, flat-footedness, that will have a knock-on effect onto every bone, joint in your body, including your neck. And symptoms like headaches, symptoms like sort of shoulder problems can all be potentially be coming from the foot. So one of the things that you get when you go to see a chiropractor, especially with myself, is that you will get a full health check from your feet right up into your neck and shoulders. So let me make sure I'm covering everything. So what will happen when you have a chiropractic adjustment? Well, we'll improve your mobility and your posture, will improve the nervous system function. Hopefully you understand now how by taking that pressure off the joints, off those circuit boards, we are getting the pressure off the nerves firing better. And also mental and emotional well-being. Now, I've been in pain. I've been in that situation where I couldn't move without shouting out because it was hurting so much. Felt like a knife was being dug into my back, and I was getting cold sweats every time I moved because of the pain. I've been there, and you might be one of those listeners out there now who's going through that at this moment. Well, it's absolutely something that chiropractic can potentially help with. So what was happening with me was that my L4-5 was getting jammed up, and because it was so jammed up, every time I tried to move, the muscles were going into spasm, trying to hold everything back because it knew that if it moved, it was going to hurt. So a very good chiropractor came along and helped me to get my joints moving, and ever since then, I've been having regular chiropractic care, and I've had no sort of back problems at all. But the problem I was also getting was I wasn't able to sleep because of the pain. So one of the ways that sort of chiropractic adjustments can help is by getting rid of your symptom, and then you're going to be able to sleep better. You're going to feel better, because you and I both know that when you're in pain, you're not nice to be around, and your family members, I'm sure, will vouch for that. And it's not a nice feeling for you. It definitely isn't nice for the people around you as well, because you're grumpy, you're upset, because you're in pain. And pain's a horrible thing. So we can absolutely help you with all of that. Improve your posture, improve your movement, give you pain relief, get you emotionally feeling better, like get you sleeping better, but most importantly, get your natural system working. Now, the great thing I love about chiropractic is that we're all about helping your body naturally to heal. We're not giving you pharmaceutical medications that are going to have adverse side effects, potentially. What we're doing is we're working with your body to help your body to work as well as it can for you. Because by doing that, your body is going to heal in a more natural way, and you are going to get the benefits of it without the side effects. Yes, you may feel a bit sore and achy, but that sore and achiness will dissipate, will disappear, and you'll get your full range of movement back. You'll get your body back to the way you want it to do, go back to doing the things you want to do. So, if chiropractic care is something that you think you might need after hearing that and understanding that it's one of the most natural treatment methods out there for getting yourself into a pain-free state, right, then you need to get yourself checked. And if you're in the Bedfordshire community, all you need to do is go to our website. You can book yourself in, or even better, give us a call today, right? Our number is available on the website. It'll be available down below this video as well. And give us a call today and get yourself booked in, and let's get you treated chiropractically, get you all the benefits that chiropractic offer, and get you back to living your life. Because life's too short as it is. Why would you want to live it in pain? Let's get you out of pain, get you doing better. So if that's something you want, give us a call today, and let's see what I can do to help you. God bless you. Go and find out where your local chiropractor is, and go and give them a call, get yourself checked out. If you are local to us, then obviously we're here for you. Follow us on social media, follow us on Instagram. Do look at some of our other YouTube videos. If you found this useful, pass it on to your friends and family, because I'm sure that they've got in their minds, what is chiropractic? How can it help me? Because chiropractic is not just for when you're in pain, it's prevention as well. If you aren't getting any symptoms, don't wait for symptoms. Get yourself checked today. And I look forward to helping you. God bless you. No greater wealth than health.